So let's look at these common scenarios. And this is one of the reasons why, it's important for us to do these kinds of ethics trainings is because these kinds of scenarios are becoming more and more common. For example, Sam provides telehealth services and uses email for booking and confirmation of appointments. He receives an email from a client in the middle of the night who is experiencing a crisis. Sam does not see the email until the next morning and wonders how best to handle the situation. Or we have Brittany. Brittany works for a nonprofit that provides services and financial assistance to single mothers. A colleague of Brittany's is suggesting in a team meeting that staff should monitor clients on social media to ensure that the clients are meeting criteria for the program. Some staff are in agreement, but others, like Brittany, are concerned about the ethics of the organization moving in this direction. So we have two very different scenarios here. One is a clinician that is using technology to book, confirm appointments, which a lot of practitioners are doing, but then is getting a crisis email from a client in the middle of the night. So email is technology. So we have to look at, crisis protocols and services and what is our ethical responsibility if we have those mechanisms such as email, texting, et cetera, a Google Voice number, all of those things. And then Brittany is in an agency, and there's a suggestion that in order to qualify single mothers for the program, there should be some vetting of these mothers by looking at their social media. Is this a hardship situation? Are they demonstrating that they have more financial means than what the program is really allowing? And Brittany and other staff members have an issue with that ethically. Is that ethical to be using social media to determine whether or not somebody is a good candidate for receiving services? So those are things to think about, just two things to think about in the context of technology and ethics. So let's talk about the history of technology and mental health. This may surprise some of you. The use of video conferencing in psychiatry began during the 1950s. If you can believe that, we've actually been providing some level of either medical or psychiatry services as far back as the 1950s. On these big black and white screens, it was very rudimentary, but we do have this historical information that shows that 75 plus years ago, we were providing some level of video conferencing to psychiatry patients, which just blew my mind. Before I read this article, I thought it was like the 80s is maybe when we had kind of started. So the 1950s. We have been using different aspects of technology in our field since the 1980s. For example, to communicate with clients, obviously by phone, sometimes using fax machine to communicate with other providers as well. Managing confidential case records, we really saw in the 1980s. That was the beginning emergence of what we now call EHR, electronic health records. And again, very rudimentary back in the 1980s, but historically, we do have information that shows that we were beginning to keep client records as far back as 1986. Also, accessing information about clients. This is where in the 1980s, we really began to see databases being created. Now, this was really before HIPAA and before this focus on privacy laws and regulations. So it kind of begs the question, who was viewing those client records back in the 1980s? Who had access? Who was sharing client data and information before we had HIPAA and before there were legal and ethical guidelines and constraints around sharing of client information? We were also providing social work education, supervision, and administration way back in the 1980s. So the 1980s, we had our first social work partially distance education program for a degree in social work. Forget the university. I believe it was a university out in California. California is usually first in doing a lot of things. And so I believe it was California that was really had that first partially distance provided social work education. So, really interesting when we look at the history of technology going back several decades. Okay, a little bit more about technology in mental health. What we know, especially in the last 5 to 10 years, I would say, we've seen more of this focus. We've seen more of an identification of artificial intelligence and that term and that verbiage and that language becoming more of a common and frequent discussion in our field. We also have seen, obviously, the emergence of teletherapy. What event has really propelled teletherapy into more usage within the last 3 to 4 years? We were using teletherapy before this event, the sociological event, but what really has propelled teletherapy to become more common, not just within medicine, but also within mental health as well? COVID, absolutely COVID, right? So before COVID, we had companies such as MD Live was one of the first companies back in, probably 2012, was really beginning to propose and advertise and create the first globally in our country, kind of, across the country, national kind of emergence of providing therapy specifically to clients. But COVID has really led to this explosion of technology and mental health, specifically teletherapy. We've really seen a rise in combining mental health with technology. And one of the reasons why we've seen that is that it offers the option to expand service delivery. So think about the pandemic, think about how people were isolated. People's mental health problems did not go away. In fact, they got kind of worse for some people during the pandemic. And so you had people that were incredibly isolated from their community, from their loved ones, from mental health services going in person. And there was a need there. And so there was really this emergence and this, trying to fulfill the need during the pandemic. The other benefit that we see specifically in being able to bring, for example, teletherapy into more use is for people that live in more rural communities. People that, their closest community mental health center or private therapist is going to be 30, 45, 60 plus miles. So for them to be able to realistically drive back and forth once a week to a therapy appointment or to be able to participate in any other kind of mental health services, even a psychiatry appointment, may not be very possible for people that either live in rural areas, lack transportation, or may also have some mobility issues. That's another thing that we need to be thinking about in terms of looking at how teletherapy has become more common, is trying to meet the needs of people that may be homebound, people that struggle so much with their mental health that they're not able to leave their house, perhaps. So we'll talk more about teletherapy specifically later, but just to give some context into this emergence in the last 5 years, especially, really looking at COVID. And now we're on this track, right? We're on this track now. It's almost like you can't unring a bell. Now that we've opened up the doors to technology in our field, now we have a responsibility to put a magnifying glass on what does this mean ethically for us as professionals. So the bottom bullet point that you see here is kind of the theme of our presentation today. Clinicians should take efforts to understand the proper uses and impacts of technology use in mental health care. So that is the case whether we're talking about teletherapy, AI, social media, or any of the other things that are kind of popping up in the realm of technology.